Hi, everybody.
Good morning or afternoon or wherever you're at.
Yeah.
Good morning.
So we're talking about the axioms of naturopathic medicine. And today is the law of suppression. So welcome. This is the Vital Conversation. And it's Dr. Letitia Dick Cronenberg and me, Eli Camp. And that's what we're talking about today. I'll give you the floor.
Okay. Well, thanks, Eli. It's always a pleasure to do these with you. And I'm really excited that we get to do this series because this is where it's at, right? This is the law of nature and how we work with the laws of nature and how we see our patients in this scheme, right? Suppression is the third axiom we're talking about today. I'm going to start with a quote from Louisa Lust. And this is a quote that is in the Nature Doctor's book. If you have that book, it's really a historical, neat archive of our previous physicians. And I love using this quote. I use this all the time when I teach constitutional hydrotherapy courses. Louisa Lust, she was born in 1868, died in 1925, and she was the wife of Benedict Lust, father of naturopathic medicine. And the quote from her is, "When there is fever of any kind, the vital force is trying to get rid of the poisons. Give the patient an enema of lukewarm water and a tea of rhubarb powder once daily. No solid food whatsoever. Give the patient an ablution of cool water every hour. Normal function of the organs will take place and the fever will stop. It is the poison and the toxins in the system and the foolish medicines which kill, not the fever. Fever should never be suppressed." So we suppress so many things in our world these days, and it's such a common, it's almost like ingrained in the American model that if a mother has a child that has a cough, give something to stop the cough. If there's a fever, give something to stop the fever. If there's a headache, give a pain reliever for that. So it's such a thing. Well, I don't want my child to be in pain, so we have to give them something, right? Rather than supporting the body to naturally come back into balance and naturally heal. And it's a fear-based medicine that is ingrained in this allopathic approach that's ingrained in Western medicine, that is fed to us through television commercials. It's fed through us through this whole dynamic of going to a doctor and getting a pill to fix a symptom. And it's so suppressive and injurious to the metabolism. But I thought that quote from Louisa, was just really pointed and just real basic.
Oh, it is. It totally sets the stage. I mean, if we had to define the law of suppression in a sort of sentence, I'll tell you what mine is, and then you can enrich it because I know it will happen. So when I'm trying to explain it to people, I'll say, well, it is really anything that opposes the healing attempts of the body. When you oppose the body's healing attempts, that is the beginning of suppression. I'm sure that, we could go into more depth on that, but really, if you boil it down, isn't that that's at least where it begins, right? We know there's lots of ways to suppress, but you oppose what the body is in its innate wisdom, the vis medicatrix naturae, right? It knows, right? And if we oppose that, that's the first step of suppression, I think. What do you think?
Yes, we've stopped the body's wisdom. The body is wise. It's doing these things on purpose. It's bringing up that fever. It's bringing up that whatever that part of the discharge needs to happen to return to normal health. It has to do that. And it's going to try to do it again and again and again. So the more you suppress it, the stronger, if the vital force is still strong enough, it will react again and the fever will rebound. We talked just before the call here, you were talking about a situation like that.
Mm-hmm.
You want to expound on that a little?
The first time we talked or right before we went live? I forgot.
I don't know. It was about, we were talking about a fever situation and
yeah. Okay.
giving the homeopathic remedies.
Mm-hmm. Mm-hmm. Where you give, so when we give a homeopathic remedy or we do any modality that is considered vitalistic, right? We're assisting the body. So you give a remedy, you're going to see the temperature go up. Is that what you're talking about?
Yep. Mm-hmm.
Okay. So we see the temperature go up a little bit. It's not going to spike, right? But it goes up a little bit. And then when the body's ready, right? It's going to do whatever it needs to do to address whatever that fever has elevated, and it's going to bring it down naturally. And then it may stay normal, or it just may be less than it was. And at some point, you're going to have to possibly intervene again, likely intervene again. When do you do that? Yes.
Mm-hmm.
Well, you have to let the body finish its work. If you intervene too soon and try and stimulate it to do what you think it should be doing in that moment, you are going against the body's the wisdom.
Mm-hmm. Mm-hmm.
Yeah.
And we know that we can suppress with our natural modalities. We can suppress with herbs, and we can suppress with homeopathic medicine. So you need to be wise and follow the body's cues as to what you need to do. And that takes more effort than an allopathic doctor going, oh, here's a script and walking away. I mean, you have to be really with that patient and understanding the case and understanding what's going on with that situation, especially if you have a child with 104, 105 fever and meningitis. So it's imperative to understand our medicines and understand these laws so you know how to work with them. Yeah.
I think that's a big thing that you just said. If you don't know what the body is supposed to do in this healing attempt of its own, like what does that look like in clinical practice, or what does that look like in real life? You have to see that at least one time, preferably many. This is what I found. Until I saw it that first time, I understood what we were supposed to be doing, what we were supposed to be looking for, what we weren't supposed to be doing, but it wasn't tangible to me until I saw things get a little worse, till I saw exonerative discharges, healing discharges, where I saw the body look like it was returning to normal and then go through another wave. Because, I was watching people who are really ill, and that's just how we heal. A layer after layer after layer of suppression. And it wasn't until I saw that the first time that I was like, so that's what this is all about, right? I'm helping the body. So then I had to learn, what are the healing actions of the body? What do I see that tells me the body's healing? Well, can I go back to that idea of the model in the America, especially in the United States, why it's so marked? So it'll be quick because I know we want to talk about cases too, but I think it is so marked here in the United States because it's fast and easy. Suppression gives you immediate results.
Right.
And I think this is why Pasteur became, other than the fact that Pasteur was favored by the King of France, and you don't irritate the king's friends, but this is why he was so popular. Even though he held no credibility with his peers, he was not admitted to the Academy of Science till the end of his life. He had very poor peer review, and he left a trail of illness and disease behind him wherever he went. Just read about the early days of TB. and the early days of trying to get the huge grapevine infestation under control in France. Pasteur was in the middle of that, along with Béchamp. So we can compare Pasteur to Béchamp. He was an excellent scientist, held in high esteem by the Academy, and he seemed to follow behind Pasteur, cleaning up his messes. He was there to help clean up the TB mess. He was there with the grapevines, and he fell by the wayside because he was a scientist. He wasn't an activist. He was, and because, you know, he was at odds with Pasteur, the king did not smile on him. And I think Béchamp's conclusions put the responsibility for remaining disease-free on the person and not the bugs floating around, which are always there, like Pasteur did. So I think that's how we got here.
Yeah. Yeah. Suppression is quick and easy. It's miraculous. You take this drug and the symptoms automatically go away. And wow, isn't that cool? And look what we can do with these drugs. That doesn't bring resolution of the disease and healing.
Exactly.
Yeah. And I think what you and I were talking about earlier was that before the call was that most of the work we're doing is undoing all this suppression in our cases, our patient cases. It's like, well, how many surgeries, how many drugs are you on now? You're suppressing this and you're suppressing that and you're suppressing this. Now what do we do? And it's really hard to even see a clean homeopathic case because we're spending, you know, working with, well, that's a side effect of this drug, and this is a side effect of that drug. And, you know, most of my time is spent getting people off these drugs and getting them healing with hydrotherapy and things. And then you can see the remedy picture. Then you go, this is the situation, right? Yeah, suppression is so bad.
In the early part of your practice, or even in your dad's practice, was it less unpeeling the suppressive stuff? And like in the last 5 or 6 years, to me, it seems like either people are becoming more aware that this is a thing and they're trying to figure it out for themselves, or there's just, we're seeing the long-term results of pharmacy and this kind of medical approach. Like, but mine are so many these days.
Yeah, you know, when my dad was practicing, things were pretty clear cut. I mean, people would come in maybe with chronic stuff that wasn't cleared by antibiotics. You know, they still had infections and problems and the antibiotics didn't work, or a few things like that. But, you know, people weren't chronically taking antacids and weren't chronically taking antidepressants and weren't chronically taking all these other drugs. And, you know, now people come in to see me, they're typically on 3 to 5 medications and proton pump inhibitors and something for sleep and something for, you know, all these things. And it wasn't used to be that way. I want to go back and say something. You triggered a memory in me when you said something about infections. I don't remember. Anyway, let me go into this diatribe here. So my dad had it, or when you see it, when you actually see it for yourself as a doctor, it's like when that happens, it's like, okay, I get it, right? And so here is my get it moment. Well, my dad had a case he would lecture about. There was a girl who was marching in a high school band, and she had a blister on her heel. Well, it became septic. And when he saw her, she had a red runner up her leg. And so he started treating her. I think she'd taken an antibiotic and it hadn't worked or something. Anyway, so she comes in for hydrotherapies. He gives her remedies. He packs the wound with black salve, a drawing salve, and she starts running a fever. Perfect, right? You expect a fever. So she starts running the fever and he says, now it'll heal. She'll be okay. And within like 3 days, the fever broke and the wound had nearly cleared up and the sepsis was gone, etc. So I had that case in mind when I had this girl come into my practice, and the mom said, we've been to urgent care, and she's a dancer. She takes dance classes, and she was dancing around her living room, and they have fairly shag carpet, and she stepped on something barefoot and it went up into the heel of her foot. Well, they'd gone to urgent care and they had tried to get this out, whatever this thing was that was jammed up in her foot. And they go, well, we can't get it out, but here's an antibiotic and you have to go see a foot surgeon. Well, the foot surgeon says, well, we're going to lance her foot. We're going to, really destroy that muscle. And she'll probably have a problem with her foot all her life because we have to cut this open. And the parents were like, we're not doing that. So they come to see me. Well, at this point, there's a septic wound, this big on her heel. The foot is swollen and hot. She can hardly walk on it. And there's still something jammed up in her foot and the heel. And she's got a small red runner up the leg. And I'm like, okay, obviously the antibiotics aren't working anyway, but finish the course because we don't want you to be resistant. So finish the course, but let's start treating you. So I had that case of my dad's in my mind, and without that courage, without that knowing that he had treated this before, I can treat this too, right? So I'm like, I've never done this. Okay, let me try this. So we're doing hydrotherapy. She's doing cold socks on the foot at night. I give her homeopathic ledum. I gave her silica to eject whatever that was. We were doing black salve packs as a drawing pack to pull whatever that thing is that's stuck up in her foot. And really within 24 hours, she starts a fever. And I told her mother, she's going to start a fever. Don't suppress it. Don't take aspirin. Don't do anything. Please let the fever go and get her in here every day for hydrotherapies. I want to be monitoring this infection. And I had, made a little line with a Sharpie on her skin where her, sepsis was, or the redness was. And so she runs a fever, it goes about 103. That's great. This is fantastic. I'm so glad this is happening. Encouraging them, keep going with this, keep fasting her until the fever breaks, just give her water, keep doing the remedies. 48 hours later, the fever's broken. There's no sepsis. There's just a little bit of pinkness around the wound. And the girl comes running in like nothing's happened and full weight on her foot and everything. I'm like, you're not out of the woods yet. Okay. You still have something stuck in your foot. So, and she goes, but I want to go back to dance class. I said, you can't go back to dance class. You got something stuck in your foot. So don't do that yet. And so within 3-5 days, she's doing great. And she's, driving her parents crazy because she wants to start dancing again and stuff. And I discharged her from care, but I told the mom, I said, that's whatever that is going to come out. You keep taking the silica and let's keep doing the black salve. And it's got to come out soon. It's close. It's coming out soon. I still couldn't visualize it, but it was coming out. And so the mom calls me, and maybe this was 2 weeks into the procedures. She calls me and said, so yeah, I pulled out a straight pin. It was a 2-inch, 1.5-inch straight pin got straight up in her heel. But, suppressing that situation, suppressing the fever or suppressing the body's wisdom to eject that substance in her foot. I mean, she would have gone through major surgery, probably rounds and rounds of antibiotics, just constant. I mean, it would have just been a mess, and here it was within a week. She was fine. She just had this thing in her foot. So, but that's, that was, it's interesting when you have the experience and you can trust the vital force to do these things. It can do these things. It really can. And so you try very hard not to suppress. And there is a difference between palliation and suppression. So we can palliate without suppressing the vitality. So know that that's a thing too. So, yeah.
So I'm wondering because I know when I first got it and then, it completely changes how you treat people, right?
Yeah.
Right? Okay. So I used to, when I first got out of school, even before school, because I was a herb nut, herbal medicine nut, I would use things like a cough. I wanted to touch on these other ways we suppress. So an herb, And I would always go to the herbs that I read about or were in my little books to stop the cough. So if it's a wet cough, this, or a dry cough, that. And then, of course, we learned herbs through naturopathic school and great conferences. And every once in a while, somebody at one of the conferences would say, you know, we're not really trying to stop the body from doing this. So when you choose your herbs, you want to support the body and what it's already doing. But that was just mentioned here and there. And it wasn't really until I started, you know, learning from this sort of vitalist crowd, the idea that, okay, well, if the body's coughing and trying to get rid of something, what kind of herb would we do, right? How can we support the body in expelling? Well, we thin the secretions so they come out more easily. We support the detox of the body. We, you know, make sure they're breathing. We make sure that the form and function, right, of their body is supposed to be there. And it makes a huge difference. Coughs last, you know, less time. They resolve on their own because you allow the body to do it.
Right.
Yeah.
You
or
open
hydrotherapy.
You open the emunctories, right?
Yes.
Open the emunctories, right?
Yeah.
So that can happen.
So I wasn't poisoning the body with pharmaceuticals or lab-made medications when I was trying to stop the cough, but I certainly wasn't doing that, assisting the body to heal itself. I was suppressing.
Yeah, you're using herbs as a drug.
Yeah.
Yeah. Yeah. And that's common. I mean, herbs are drugs. That's initially where drugs come from.
Right.
And so you need to know if you're using them to suppress, are you using those herbs to palliate, which needs to happen to help that person out of suffering? Or are you stimulating? Are you opening emunctories? Are you activating those pathways of elimination and allow the body to restore back to health? That's critical, I think.
You know what I went over last night with the crowd I'm doing homeopathy chats with is the primary and secondary response as a way, right? As a way to remind folks that we're looking for that thing that will stimulate the body so the fever goes a little bit higher, or the cough gets a little more intense, or the headache gets, you know, a number higher, right? That what will do that? And then the body kicks in and it starts to correct. And so I went over that primary, secondary, whereas in the allopathic approach, you give something and the primary response is for that response to be low. So in case of a fever, boom, it pushes it down. Or in the case of a headache, it numbs out the pain. But that's not, you want to flip it around and do it. We want to do it the other way.
You didn't resolve the headache by just taking the pain away.
Yeah.
The problem's still there. You just can't feel it to that extent. Right. Yeah. Well, I'm going to quote Lynn Lahr here real quick. And then I know you have another case or you wanted to present here. And then I think we'll have time for Q&A. So Lynn Lahr, I was just flipping through this morning thinking, what did Lynn Lahr say about suppression? And it's all through the book. So it's hard to say like one particular chapter here because it's in everything Lynn Lahr says here in the book of philosophy. So I have the old book, volume 1, philosophy.
I'm jealous
of Lynn Lahr. And so this is chapter 9 on inflammation. And he starts off with the story of inflammation according to Orthodox interpretation. And so he's talking about microscopy and probably Pasteur's issues and things like that. But let me go to this is a long paragraph. So let me just read this part. It must further be seen that the growth and development of bacteria and parasites is inhibited and finally arrested by their own waste products. We have an example of this in the yeast germ, which thrives and multiplies in the presence of sugar in solution. Living on and digesting the sugar, it decomposes the sugar molecules into alcohol and carbonic acid. As the alcohol increases during the process of fermentation, it gradually arrests the development and activity of disease germs and parasites. They produce certain waste products that gradually inhibit their own growth and multiplication. The vaccines, serums, and antitoxins of medical science are prepared from these bacterial excrements and from extracts made from the bodies of bacteria. In the serum and antitoxin treatments, therefore, the allopathic school is imitating nature's procedure in checking the growth of microorganisms. But with this difference, nature does not suppress the growth and multiplication until the morbid matter on which they subsist has been decomposed and consumed, and until the inflammatory processes have run their natural course through the 5 stages of inflammation. While serums and antitoxins given in powerful doses at the different stages of diseases may check and suppress germ activity and the process of inflammation before the later have run their natural course and before the morbid matter has been eliminated. That's suppression. You have suppressed that morbid matter into the tissue. And now the disease changes. Now you don't just have the strep throat. Now you've got the heart condition and everything else that goes with it, right? So besides that, these powerful poisons cause permanent injury to the cells and tissues and organs of the body, which frequently results in a serious chronic after effects or the mysterious sequelae of medical science. There is no excuse for resorting to these doubtful and dangerous agents in the treatment of inflammatory processes when nature cure methods will produce satisfactory results in a simple, natural way.
I'm so glad we recorded that. Right?
Lindlar is amazing. I mean, that is exactly what happens. You cause the body to still, you stop the symptoms, but the morbid matter is still there. That toxemia is still there. And the body has to figure out what to do with it. And now, if it can't eject that through the emunctories, now you've got chronic inflammatory disease. Now you have to treat an arthritis, or now you have to treat a chronic lung degenerative emphysema. Now you have to treat, cancers or tumors, because the body then has to store that toxin somewhere. It can't live with it there, so it puts it somewhere, right? And so that's what causes chronic disease and degeneration. So I encourage you guys, if you've got Lindlar's book, read chapter 9 on inflammation, because he also talks about the 5 stages, which he calls incubation, aggravation, destruction, abatement, and reconstruction. It follows very closely Dr. Jared Zeff model of healing, where you have an irritant, you cause an inflammation, you have a discharge and return to health. So it's so cool.
The body is amazing.
Yeah.
Not just the body. Life, the way life was put together is so amazing. We're taught that the white blood cells and the immune system and the supercharged soldiers come running through our body and gobble things up. And they do. But there's a mechanism under that in the, like what Lindlar just said, the organism living its full life cycle. It's a self-limiting life cycle. Then what's left behind, you need to have, I think, a vibrant immune system coming and cleaning things up and moving things out.
Right. You got to move out the dead bacteria. You have to move out the diseased tissue. And if you don't allow that to happen, you just compile the toxemia. You just added to the weight of the damage to the tissues, and you have damage to the organs. So that's what starts that degeneration of the organ systems. Yeah, you've got to let the cycle happen. You have to let that resolution occur.
Mm-hmm.
Yeah.
Should I do my case?
Oh, yeah. Do your
Okay.
case. This is a
Okay.
great case.
So, well, because I think you're probably gonna have stuff to say all throughout this that you've got my brain going and things I wasn't even thinking about when I did this case, and it was a successfully treated case. So this is a kid that came to me at 9 in seizures, and I've seen my share of seizures in my career, especially in kids that you would think, what the heck is going on? Well, here's what happened. And this is just not too many years ago. So I'm very right in my vitalist paradigm. So, but they come in with seizures, and they're every day, and they're multiple times a day. There's no pattern. They just are there, and they've tried a number of different kinds of seizure meds at this point, as you can imagine. And, they're talking about moving into more drastic things. So with this young age, there's this burst of people doing I've just gone blank. When you cut the brain in half, the callosum, where they cut okay. And so he's got these seizures, and I sit down to take the case, and I'm like, okay, what are you still on? The meds, things like that. They had stopped everything because nothing was working. And they were afraid they were like hurting him. Right. Okay. Well, thankfully they came to that realization when they did. So this kid starts out life with eczema. And for many of us, especially folks who've been in practice a long time, I know that you're going to recognize this pattern because we see it. We see it. So eczema, and what happens? So he's doing something, he's exposed to something, or the body is expressing something internal that needs to come out. And he had eczema from like a month old on. And so what did they do? Well, they do what every good pediatrician does, and they settle mom and dad's concerns down by giving a little steroid cream, so hydrocortisone, and oh my goodness, the eczema goes away almost overnight, and it doesn't seem to come back, right? But about a year to 18 months later, I forget the exact time, little baby is having serious ear infections over and over and over and over again. So what do? Well, they do an antibiotic, and because they're so inflamed, they do a little bit more steroid just to calm things down. So painful, whatever. They're using fever suppressors because with the ear infections, the kid's getting a fever. And this is young, right? So he's not even 2 years old yet.
Oh, wow. Yeah.
Right. So by 3, now we have suppressed complex disease in a 3-year-old.
Yeah.
Eczema, ear infection, all those microorganisms that were flourishing in a system that was conducive to their growth are now moved deeper into tissues. What does he get? Right? He gets bronchitis. He gets by 3.5, he gets the worst case of bronchitis anybody's ever seen. He's on massive antibiotics, steroids again. Then he gets that turns into pneumonia, and he's in the hospital for like 45 days because he keeps crashing. Gets out. He's had, I can't tell you how much steroid and antibiotic heavy duty stuff. What is the next thing that happens? By 5 years old, this kid is diagnosed with IBS, and they want to put him on lifelong steroid treatment, right? Low dose. Right. Then he's in school. He started school, and he's diagnosed with ADD because he can't sit still. Why? Because he's a partial person. He's missing most of his bacterial flora. There's so much disease deep in his body. He's finally diagnosed at 7 with severe depression, and they want to start him on antidepressant.
As a 7-year-old.
Yes,
as a 7-year-old. Wow.
It was approved. So dad says, something's not right about this. I want to stop everything. Well, shortly after that is when the seizures start, and they finally found their way to me through however the universe works. And I said, we have a very severe case of complex disease, toxemia, and I believe we can restore your 9-year-old in way less than 9 years to a very balanced, healthy child. I think he was still very vital. right?
Mm-hmm. Mm-hmm.
And the journey back, I mean, I won't go into depth in that, but the journey back followed Herring's laws of cure.
Yeah.
Mostly, like, I think we may see something that has been going on deeply that's more important that clears first. Like, just the visible things don't always heal in the reverse order. You have to remember what you see started right deeper, right? We have to remember that. And so mostly to the laws of the backwards progression. His ADD, so his depression cleared really fast. The depression, still had seizures. I don't know at what level we made the disease so bad, the suppression and toxemia so bad that it kicked the seizures in, but the seizures did not go away first. It was the depression and the ADD and an improvement in the IBS, the bowel function overall. Like that's when the seizures started to resolve. And it took a few months.
Yes.
And then he got bronchitis. It didn't turn into pneumonia. It did. And then his ears, which had tubes in them, just wicked ear pain for 3 or 4 days, even though the ears looked normal. And then he had eczema for almost 3 months. And let me tell you, walking the parents through these stages, because he was cured of eczema when he was a baby, and now you've brought it back. And I was like, exactly.
He wasn't really cured. It was just suppressed to a deeper level.
Yes.
Yeah.
So I did a follow-up today.
Yeah. Oh, good.
Yes. So I called them. It's been a couple of years. No seizures, no eczema, no sinus stuff, no ears. This kid is zooming along and takes his remedy once in a while if his life gets stressful.
Oh, that's fantastic. Right?
Hydro, Carol, you ran the test for me years ago.
Okay.
Hydro at home, right? Minerals, did some nutrition balancing, and of course did a homeopathic remedy, which I couldn't get for probably the first 4 months of the case.
Right. That's the problem, is the suppression is so deep, you can't see the symptoms. And a lot of times I'll have patients on the hydrotherapy table and they'll go, I'm having this thing. It was kind of like, this reminds me of when I had this other thing. Is it going to get like that again? I'm like, oh, wait a minute. Okay, what are your symptoms? Because now I can actually see a case. I can see a case, right?
Right.
Yeah.
So they were believers. Mom has decided to go to naturopathic school. Well, she's been there a year. You might imagine what our emails are about. But I just encourage her, get the basics, get the science, learn the modalities. And when you get out, just plan to spend a year doing some rotations with people, and you'll be fine. You'll be fine.
Yeah. Wow. Yeah. How cool is that? Oh, that's what our medicine's about. It's about restoring health in these people. My husband jokes and says, why just pick up a starfish and keep throwing it back in the ocean one at a time? It's like, well, yeah, I'm going to keep throwing a starfish back in the ocean, because what else? We have to restore these people back to health and save who we can and bring our wisdom to them, because we're so needed in our world these days. Naturopathic medicine is critically needed in our world these days.
It is.
Yeah. Wow, that's a great case.
For me, it was reaffirming what I'd learned at this point, is that suppression can cause serious illness, right? Who would have thought using steroids on eczema could end up with severe seizures where they're considering cutting the brain in half?
Oh my God.
Right.
Yeah, no, that's the medical mind. That's the medical allopathic theories in clear practice. Jim Sensenig would say that the medical profession has not advanced in 200 years. They have different, modern technology, but the philosophy and the basics of allopathy has not advanced at all. They still want to cut things. They still want to poison things with poisonous medications. They still want to suppress. And if things don't work, we'll just cut those troublesome body parts out, as Rick Kirshner says. So
Right.
it's they have not advanced in medicine. We have not had a major advance in medicine in 200 years.
No, and they're thankful. We're thankful, right? I know I'm thankful for some of the modalities or the therapies that they have at their disposal that can preserve life that might otherwise end prematurely.
It is amazing what they can do with open heart surgery.
Yes.
It is amazing what they can do with some of these things. I just had a little patient with a heart transplant. My God, amazing stuff. But the technology has advanced.
Yeah.
But the philosophy and the modalities basically are the same. They just have fancier ways to do it now.
Well, I'm hoping the butterfly effect takes over, and one of those starfish that you toss back in the ocean, or one of those, right? One of those people that I send home with a bottle of little white pellets that most people think are voodoo. Something is going to awaken within allopathic traditional teachings, I think, at some point, like the pendulum. It's got to come back to center. It has to, because otherwise they're going to kill everybody on the planet. So, I mean, we've got to hopefully see that butterfly effect where they understand what we're supposed to do is assist the body in healing. That's the core right there. That suppressive disease, suppressing illness ultimately kills, and it's not worth the momentary discount price of effort, right? To get what you want.
Right. I'll illustrate a very severe situation of suppression. And this is actually one of Dr. Jared Zeff's cases, and he lectures about this. And I might be getting some of these details wrong, but I'll kind of paraphrase. So he had a patient with lung cancer, metastatic lung cancer. And he was working with this man with hydrotherapy, the Carroll food intolerance diet, doing homeopathy, bringing the vitality of this metabolism up and running. And the man would periodically run low-grade fevers. And Jared counseled him, when you have a fever, you fast, you do not suppress this fever, the body's working on this. And this had been going on for a couple years now, I understand. And as they were going through this process, the metastases were dissolving. The tumors, the primary tumors in the lungs were going away. And Jared had X-ray images or MRIs of the progression of healing of this person. And he's getting better and better, but he still intermittently gets these fevers, these little healing reactions. The vital force is bringing up the vitality, taking away the toxemia, correcting the metabolism and healing the condition, right? And so apparently it was the holiday times, and it was either Thanksgiving or Christmas, and a lot of family and relatives were around this man, and he got one of these fevers. And he says, no, I know what to do. I'm just not going to eat. I'll just fast. I'll be okay. I'm fine. Really, I'm fine. But there was a family member who was highly concerned. It's like, well, you can't have a fever. You have to stop that fever. He's like, no. This is what I do, and I'm fine. But the person was very persuasive and got everybody up in a tither around him. It's like, well, you have to treat that fever. You know, that's a problem. You got to treat the fever, suppress the fever. And so he gave in, and he took an aspirin or a Tylenol. And I don't know which it was, but he took something to lower the fever. And the fever came down, and they proceeded to have their Thanksgiving or Christmas dinner or what have you. And then within 24 hours or so, he's calling Dr. Zeff and saying, listen, I'm not feeling so well. And Jared said, what'd you do? What happened? Well, I took an aspirin and suppressed the fever. Jared goes, start hydrotherapies right away. Let's get you a remedy. But within 48 hours, he was in the hospital. Within another day, he had died.
Oh my gosh.
So the thinking is when the body has that much, this is that conservation of energy thing we were talking about, when the body has that much power, a vitality focused on that healing process, you are healing cancer, by God. It was recorrecting the imbalances. It was pushing those toxins through. It was bringing back that acute inflammation and slowly processing that and returning balance back to health, balancing health. When you have that much vitality going into that one particular way and you stop it, it puts the body into shock. And Jared couldn't pull the patient out of that. And so I really bring this to my students when I teach with the constitutional hydrotherapy course, is that you can suppress it with very simple things. That situation could have even been suppressed with herbs. That person's fever could have been suppressed with herbs. And so you don't suppress when you have an acute reaction or the vitality is showing that it's returning the body back to health with that elimination process of that fever. Don't suppress it. You've got to work with it. Mm-hmm. So that was a very, very sad situation. And
that's when I get really angry.
Yeah.
That's when I get really angry at pharmacy companies, and when medicines become about money, and when even just the basic principles of how the body heals aren't taught to every single doctor, no matter what kind of medical school you go to. I mean, this is probably the cost to come in me, the injustice of it.
Yeah.
Right.
Right.
Well, we all have pieces and parts of the remedies, but I get really intensely sad for people out there who are just doing what they think they're supposed to do. They're doing what their healer is suggesting or what they've read on Dr. Google. They're just trying to do their best. And yet, because this very simple idea of don't suppress illness or you're going to get really sick is not shouted from the rooftops.
No, and in fact, the opposite is promoted.
Yes.
The opposite is promoted, just to the point that even a young mother knows, well, I need to suppress my baby's fever with the baby Tylenol. I mean, it's ingrained in Western medicine into our culture in the United States, not so much other countries, but here it's like, by God, you got to give that or you're a bad mother.
You're
right?
A bad mother. Uh-huh.
So I'm not going to be a bad mother. I'm going to take care of my child. And that's what I do. And they don't know how bad that is. And they don't know that there's another way. They just don't know what they don't know. And so they think they're doing the right thing. And it's, our grandma's traditional care is gone. It's like, well, that's old stuff. Whatever grandma did, that didn't matter. Right? We know better now. We have this.
I'm learning how to be Cherokee because I was not raised with the traditions and the beliefs. So I'm on that journey right now. And I just read a really cool little passage from its journals on the Trail of Tears. So the women who could write were in charge of documenting the journey. And there's this little paragraph about how a couple of the children got ill today. And so we did what our mothers taught us, and we wrapped them in a blanket and put them by the fire so that we could help the body.
Yeah.
Right? These words are looking at me and I'm like, this is the knowledge of our DNA. This is the truth. Right? And they were better and they got better and they went on. What is that? That is assisting the body to heal itself. And they knew this.
They knew it. They knew it. And we've known it. It's just been kind of kicked out of us. It's like, well, science knows better. These drugs know better. It's all big pharma pushing the agenda. And we know it's not the germ, it's the terrain. And but it doesn't always bring that quick fix. It's like, well, we can stop a fever like this. Okay.
Yeah.
It's magic.
Mhm.
That's what, and that's what Western medicine is based off of, is that quick fix, that quick
Magic.
magic.
An illusion.
Yeah, it's right. It's a magic trick.
Mhm.
The delusion. Yeah.
I wonder if anybody has comments or questions or
Oh, we
thoughts.
should open up for quick questions. Yeah, we're at time for sure. But hey, anybody else want to say anything? Have questions or comments here? Eli and I could keep talking forever. So
I know, right?
right.
I think I do have one question. Could you talk about a situation, like have there been any situations in either of your practices where you found that suppression was necessary? And if so, how did you come to that conclusion?
Wow, was suppression necessary?
Yeah, well, I could use my personal case if that's okay. I have many of them in practice, not many. Well, 2018, right? I ended up in the hospital because I thought I was having an appendicitis attack and I just wanted to test so that I could figure out what remedy to take if it was appendicitis and all that stuff, whatever. It turns out I had a UTI, which they didn't tell me I had, and a kidney stone, which they did tell me that I had. And because I didn't know I had a UTI, I wasn't treating anything, right? I wasn't supporting my body with some good urinary herbs or anything like that. Well, I had a barbed kidney stone and it was tumbling down my urethra and it was nicking the inside of the tube. Well, I have this high bacteria count and now I have open source right to my blood from within inside the urethra. I went septic. And they sent me home with a bag of medications, whatever, which my husband was freaking out. He thought I was going to die. He just put them in me. And I was so incoherent. I was in and out of it, right? My platelet count was falling, all that stuff. So I ended up back in there with like a platelet count, very low. I don't remember now what the numbers were. And, they had to put me on antibiotics. Like there were ways it could have been treated, but in Oklahoma, in Norman, Oklahoma, on Christmas Eve, there isn't anybody around that I could have gone to. I'm sure that I could have been pulled through with hydro. I think I could have been pulled through with the right remedy, because ultimately I think it was the homeopathy that Dr. Messer prescribed for me, which is why I'm still here, because I was in bad shape by the time he gave me that remedy. But I had already been in, they had put me on the IV antibiotics. They had put a stent in to try and let the stone come out. I mean, I don't even know what kind of concoctions I was on. It was awful. I had to sign special releases to be on some of these meds. So that was all suppressive. And the next 2 years of my life, working with Messer, working with Sensenig, and doing the things I knew I needed to do, I had to undo all of that damage, but I wouldn't be here today without that. So that's an example from me.
Right. Yeah. Sometimes if you look at that therapeutic order, sometimes you need to do these things, and don't be ignorant of that. We often have to have people hospitalized. We have to do these aggressive therapies, whether they're right or wrong. Some of them are more beneficial than others. But what I always tell people is when you get out of the hospital, then you're coming to see me because I'm going to repair and rebuild your metabolism. So that's what you have to do. And last year I landed in the hospital for 4 days. Not a place I want to be. But it's what you have to do to get through the crisis at times. And then you come out of it and then you do our work, then you restore back to health. So that's the missing part that allopathic medicine doesn't talk about. They do the strong interventions, but they don't know how to support the body to do the healing, really. You just heal by accident, otherwise. So
yeah, thank you both. That's
Well,
helpful.
I can think of just quick things too, like if somebody's temperature was so high, 106, 107, something like that, and mom and dad are absolutely freaking out, I very well might say, okay, we have to do this, but let me tell you, the minute we do this, we've just doubled the time to get better. If we can make
Exactly.
it through this little blip, it's going to
Yep.
all be over really fast. But if you can't handle that emotional wave that you're going through in this moment, whether it's for your kid or for yourself or for someone else you care for or love, sometimes for the mental state of being, I have said, oh, we'll do this. We're suppressing, and it's a longer journey, but I'm not sure you're going to make it if we don't do this. Like,
Mhm.
you know,
Yeah, there are times when you do suppress, but just know that you're doing it and you're doing it intentionally.
and then you have to fix that later.
Yeah,
Don't
you've
ever
got
leave it suppressed.
right. Don't leave it suppressed. You've got to fix that. You got to heal, open those emunctories, and maybe come back to a little acute crisis until it resolves.
Mm-hmm.
Yep, absolutely.
Gosh, did that hour go by so fast
Well,
already? Holy
I
moly.
know. Well, next time we get to talk about the doctrine of snowflakes, which I think is really fun. So, or what do we call it? Individuality or individualization.
Mm-hmm.
So thank you, Eli. I appreciate it. It's been a lot of fun. We're going to do it again.
Absolutely.
So I hope everybody has a great day, and we'll see you next time. Bye-bye.